1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
Dad, your mic's muted. Press your button.
Better?
Yep.
Okay, sorry. Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I am your pharmacist, Paul White. We're glad you joined us. Before we begin, I'd like to thank our sponsor, Aultman Health Systems. Today, Brad and I are broadcasting from our administrative offices, and our special guest is Dr. Brandon Liebau and with Aultman Medical Group, Family Medicine of Stark County. Good morning and welcome to the show, Doctor.
Thanks for having me.
All right. We'd like to remind our listeners this morning that today's program is available on our podcast. It can be downloaded from the App Store on your mobile phone. Just look for Health Matters with the Medicine Center Pharmacy, and you can listen to any of our programs anytime, and we'd love it if you could subscribe. Aultman Medical Group, Family Medicine of Stark County is certified in family medicine to help patients and families make the right healthcare decisions in continuing and comprehensive manners. Dr. Liebau specializes in pediatrics and primary care, and today we're going to be discussing important pediatric topics.
Okay. Welcome to the show, Dr. Liebau. Please tell us a little bit about yourself and your history with Aultman.
Yeah, so I'm actually a local kid. I grew up not too far from here in Jackson Township. And then I went down to Columbus for college, medical school, and residency training at Ohio State, where I trained in both internal medicine and pediatrics. So here in my current practice, I see all age ranges from newborn to geriatric. I just started this position about a year ago, where here at Aultman Family Medicine of Stark County on North Canton on Whipple Avenue. Currently is taking new patients and taking patients of all ages, including young children.
So why should I take my child to see a doctor when they have always been healthy?
It's a good question. It's really important to bring your child to the doctor for just regular wellness visits. When your child comes to see the doctor, we're assessing things like their growth patterns, their nutrition, play, their school performance. We assess for not just their physical health, but their mental health, their social well-being. And we are looking to make sure that, kids are developing appropriately. We're screening for maybe some health issues that may be developing under the surface, may not be as prominent as a cough and a cold, but maybe there's something that affects their education, their overall well-being. And those may be things that parents don't know to look for, may not be able to recognize, and it really takes the expertise of a doctor to look into those things. Most children get a clean bill of health, and that's great. And it's just good to just have those good check-ins with a doctor.
So how about this? Should I take my child to the doctor when they're sick?
Also a good question. I think it really comes down to how severe the illness is. What is the parent's comfort with the child's illness? I think there are a couple of situations where they should absolutely see a doctor. One is if your infant, so a newborn child who is 2 months of age or less. Any child at that age who has a fever, it's considered actually a little bit of an emergency for that child. The reason being is that excuse me, there's higher risk in that age for a serious bacterial infection, things like meningitis, pneumonias, things that can be life-threatening for that child. And they should be seen by a doctor, even a doctor in an emergency room. After that age, things that are really common are viruses. They can cause fevers, kids to feel really lousy. Maybe they don't want to eat and drink as much. And depending on the patient's comfort level or the parent's comfort level, how severe that kid is, maybe parents are comfortable managing that at home. But if they seem more severe, this is outside of the parent's comfort level, they should absolutely see a doctor because maybe there is something more serious going on. Or the doctor may have some treatment recommendations to help that kid feel better sooner. And certainly if there is any questions, any concerns, If you're unsure about anything, call your doctor.
Before we go on, I want to comment on something that I hear too much in the pharmacy real quick, and I wanted to get your response. I cannot tell you how many people come into the pharmacy and we recommend they talk to their doctor, and they're like, "Oh, I don't have a doctor." So can you talk about how important, especially for a child or infant, it is to have a regular physician that is checking in on your child and knows your child?
Yeah, that is can't be understated, not only for children, but for any age range, even our older population. I can't tell you how many older adults who haven't seen a doctor in many years. But if your child doesn't have a doctor, let's say they get sick, you take them to an urgent care. Well, you have one doctor that sees them, assesses, okay, I think they have this, or this is how sick they are, and things don't get better as you expect. Well, you go back to the urgent care and you see a different doctor. Well, they're not able to compare things, and so being able to determine what is going on, what is the trajectory, how do we best treat your child, it's more difficult. When you have a regular doctor, he or she is able to compare when they first saw you to the next time, and maybe the next time they can try different treatment options, and the quality of care, the comfort of that care, your trust in that doctor is going to be far superior when you have a a doctor that you're seeing on a routine basis, even for things like an acute illness like a respiratory infection or bacterial infection, something else. And it's also especially important if your child has any sort of maybe chronic conditions. Say they have something like cystic fibrosis, or if they've had a history of recurrent ear infections, things like that. It's good to have a doctor that knows your child well and can prescribe the treatment that is best for your individual child.
Okay, I got you a little off track there, but I appreciate that because I
Mhm.
agree that is so important.
Yeah.
Even in our digitally connected world, I've been finding out that not everything translates from practice to practice or whatnot. So it clearly is good to have home base in one place. So let's continue our fever talk. What temperature is a fever, and what is the best way to check a temperature in an infant or a child?
Good question. So a true fever is a temperature of 100.4 degrees Fahrenheit. If anybody is using Celsius around here, that'd be 38.0 degrees Celsius. Not uncommon where parents will say, hey, my child had a fever, they were 99.6. That may be a little bit warmer than their typical temperature, but a true fever is at 100.4. And that really matters, again, when we're talking about that infant, that less than 2 months. If it's less than that 100.4, for me as a doctor, that really changes what I do. Now, parents may feel, hey, my child felt really hot, felt really sweaty, doesn't feel like they're normal. Other signs of maybe a fever going on could be they are not acting like themselves, maybe they're not as playful, just lounging around, things like that. The best way to check a temperature, the most accurate way to check a temperature is a rectal temperature. Gives you that core temperature. And especially in an infant, that's going to be the best way to check a temperature. For people that are not comfortable with that, certainly as the child ages and, maybe more squirmy, using an axillary temperature can be a good substitute. We would say stay away from oral temperature, so putting a thermometer in the mouth, until they're at least like 4 years of age. The reason being is there's a high risk of potentially causing trauma to the mouth if you're checking it in the mouth. So really rectal is best, and then maybe an axillary, and then you can do the oral temperature as they get older. Some people use the forehead monitors. Those are just not very accurate.
Okay, excellent.
Jeez.
And when you talk axillary, you mean under the armpit? Is that what we're talking?
Yeah, exactly. Yeah.
Okay,
So axillary under the armpit here, and you want to make sure that you kind of have the child cup you'll want to hold the armpit in because they're going to want to squirm and move things around.
cool. Okay. All right. So what if my child was just seen in the ER for an illness? Why is it my pediatrician's office calling to schedule a follow-up?
Yeah. So when a child is in the emergency department, the thought is, hey, maybe they were really sick. Maybe they had a severe illness. They were stabilized in the emergency department, maybe considered safe enough to go home. But it's good that we follow up with a child that was potentially sick enough to be in the emergency department to make sure that everything gets better. We don't want to have a situation where that child goes home and then the illness gets worse and maybe they get sick again because nobody, a medical professional, hasn't been monitoring the situation. It's also part, I think this is good for parents and patients to understand that when it comes to owning the care of that child, when the child leaves the emergency department, there's nobody really taking ownership of that care. And so if we transition back to your medical home, your pediatrician, your primary care doctor, then that doctor is able to understand, okay, this is what's going on, this is what their exam looks like, and now I can assume care moving forward if they give me a call or things like that. It's harder, not impossible, but it's harder to do that when they haven't been seen by that provider.
Jeez.
All right, well, our first break's here. We better get her done.
Okie doke. You're listening to Health Matters, the Medicine Center Pharmacy.
Are you tired of paying hundreds of dollars to find out your thyroid, A1C, cholesterol, and vitamin levels? You don't have to anymore. Schedule your low-cost lab test at the Medicine Center Pharmacy. You can get your A1C, thyroid, and vitamin D lipid profile, which includes your cholesterol levels as well as glucose results. Test results in just minutes, and you can share them with your provider. Call the pharmacy or schedule online at midshoprx.com. Medicine Center Pharmacy with locations in Canton, Louisville, Minerva, and New Philadelphia. Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off and Out by store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off and Out by store in Louisville, next to the Medicine Center Pharmacy. The Medicine Center Pharmacies are now offering a service to help support your medication needs. We want to make sure that you have the medications you need when you need them. We will contact you 5 to 7 days in advance of your next medication refill to start the process each month. We will review your medications with you. We will contact your physician to initiate the process for refills and schedule a convenient day for pickup or home delivery. We simplify medication pickup into fewer pickups each month at the Medicine Center Pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off and Out by store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off and Out by store in Louisville, next to the Medicine Center Pharmacy. Have you ever gone to the pharmacy and decided not to fill a prescription because of the price? This is pharmacist Paul White. If you have skipped filling a prescription or a dose because of the price, we have great news for you. We are introducing a new membership program with wholesale pricing on every generic medication. Memberships are $5 a month. For many of our customers, our wholesale pricing is even less than their copay. Visit our website, midshoprx.com, and use our price checker to find out the price of your medication. Great deals at Medicine Center Pharmacy.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. Are you ready for vaccine season? Stop in or schedule your flu, pneumonia, COVID, or shingles vaccine online at midshoprx.com. Are we still doing the flu, Brad?
No, flu's pretty much gone, but we're still doing quite a bit of pneumonia and still have shingles opportunities. So, if you need, there's been some changes in pneumonia vaccines. So if you have questions about which one you need or which one you've had, we can look all that up with the state database and make a recommendation. So don't overlook the importance of pneumonia and especially shingles this time of year.
Just for our listeners, the new flu vaccine probably shows up around July and August. Isn't that about correct?
It's probably going to be August, September this year, but yeah. So,
okay.
Yep.
Okay. Go ahead.
Okay. So One question we get in the pharmacy a lot too is, my child is sick all the time. Do they have an immune system problem I should be worried about?
Yeah, I hear that a lot as well. Uh, the vast majority of children probably all have normal immune systems. Obviously, there are occasions where yes, children there are opportunities for immune deficiencies that can be seen in a child, but I would say the vast majority of children have normal immune systems, and even that's in the kid that is getting sick every month, or is getting recurrent ear infections, or is constantly sick for one reason or another. Some common reasons for that is maybe your child is being exposed to lots of different kids who are sick. So that can be in daycare, that can be in maybe your like church or place of worship, if you're in like a nursery or something like that. Maybe just hanging out with family members and they have other kids. Kids are notoriously dirty. They're wiping their face, they're putting random things in their mouth. There's so many opportunities for children to get sick. Um, if there is concern for an immune deficiency, it's really important to talk about that with your doctor, and they can examine your child, review their history, and see if there's anything that is concerning for an immune problem and if further testing is needed.
Um, okay, so how do I support my child in meeting their developmental milestones?
Yeah, like all parents, I think we want the best for our kids. We want them to be smart, happy, healthy. And part of that comes with meeting their milestones. There's milestones for physical development, things like gross motor, walking, running, throwing, fine motor, using their hands, grabbing toys, stacking blocks, talking, thinking, problem solving. At an early stage, say infant, newborn, early toddler stage, play is one of the biggest ways that children learn and develop. Playing with blocks, playing with music, playing
Hmm.
with their parents, or maybe even other children as they get older. So, encouraging lots of play and participating in play with them as a parent, not just having them play on their own, but engaging
Hmm.
in play with them. That helps them to learn some of those motor skills, but also some of those social skills. And then another one that I would really advocate for is talking with them and reading with them and singing with them too. Those really help to promote language development, grammar, vocabulary, really starts to stimulate that cognitive processing. A lot of our brain development comes through language and comes through reading. So even, at a newborn stage, as young as 1 month old, you can start reading to them. They may not totally
Hmm.
understand what you're reading to them, but you can still read to them. It's a great way for babies to
Hmm.
develop.
Wow. Okay, what about eating? How much should my child be eating?
So it really depends on their stage of life. When we are talking in that infant age, that 0 to 1 year old age, we want to focus on breast milk and formula. So whether you're breastfeeding or formula feeding, that should be the primary source of their nutrition, especially up until 4 to 6 months of age. They should be exclusively breastfeeding or formula feeding. Once you start introducing table foods, those should still be the base amount of their nutrition, and those will eventually table foods will slowly kind of take over for the formula or breast milk until you are eating 3 meals a day, maybe 2 snacks, 1 to 2 snacks per day when they're 1 year and above. Going back to our breastfeeding formula, nutrition needs change as that child ages. Typically, in the newborn stage, we're talking about eating every 2 to 3 hours. Maybe after that first week of life, they're eating 1 to 2 ounces every 2 to 3 hours.
Hmm.
Moving up to 2 to 3 months, they may be eating upwards of 2 to 3, maybe even 4 ounces of breast milk or formula every 3 to 4 hours. Eventually, children will kind of space how much they're eating, but also eat more in volume. And then they may peak about anywhere from 26 to 35 ounces of breast milk or formula in a 24-hour period.
Hmm. Interesting.
Yep.
Okay, how can a parent tell if a breastfeeding baby has tongue tie?
Yeah.
Is that a
So tongue,
normal question? I can go ahead.
it's a question I get all the time, actually. So tongue tie has been something that has been, I feel like going around on the internet, going around social media and in mom circles. And so tongue tie is a potential condition where if you look under a baby's tongue, they may have a frenulum or a little strip of tissue that attaches from the base, the floor of the mouth to the bottom of the tongue. Very common. Most babies have one, but depending on the position and how tight that tissue is, it can impact the ability of the tongue to move. And why that's important is when a baby is breastfeeding, the tongue needs to extend out of the mouth and wrap around the breast, and it coaxes the milk out of the breast. Um,
Hmm.
Compared to maybe like if you or I were sucking on a straw or a bottle, we usually just use our mouth and our lungs. Babies really use the tongue to get that milk out.
Hmm.
If the tongue's not able to extend out, we may call that tongue tie. Sometimes, parents will
Hmm.
say, "Hey, I'm worried that the baby's not eating enough. My breast hurts with breastfeeding. I'm not letting down very well." And if they see that tissue, they may say, "Oh, maybe they have tongue tie." Um, which is certainly possible, but really we want to see if that tongue is extending out, then they probably do not have tongue tie. There's lots of reasons for babies to maybe not be efficient eaters, maybe that breastfeeding to be uncomfortable. Even though it's an instinct that they're born with, they still have to practice. They still have to learn that skill. And typically it does get better with time. It's something that, reading reports and reading literature, it's probably something that we're overdiagnosing. The treatment is to snip that or perform a procedure to remove that tissue. And so that could be an unnecessary procedure, a painful procedure that we're performing on children. And so I think first steps is really talking with your doctor, and maybe talking with a lactation specialist and seeing what they think. And really the gold standard to say, is this child breastfeeding effectively, is tracking their weight. If they're growing effectively, then they are getting adequate nutrition. Now, there may be things to adjust the breastfeeding technique so it's not painful and maybe goes more smoothly. But if they are growing as we expect, following their growth chart, then they're getting enough nutrition.
Interesting. Gosh. Okay.
All right. So when do you introduce baby food?
So we would say babies should be exclusively breastfed or formula fed until 4 to 6 months of age. Exactly when that can be baby food can be introduced varies a little bit on the baby's development. So they should be able to sit up in a high chair on their own, not kind of falling over, not needing additional support, but they should be able to sit up on a chair on their own. And that's really kind of the main milestone. And then you can start to introduce foods. One of the things that with foods is at that stage, they're used to just liquid. So really starting with something that's probably in that puree form to start so that they can safely swallow and not choke. Baby-led weaning has really been coming into prominence, which says, hey, let's just give them the table food. But I think especially in that early setting when they're
Hmm.
still learning to swallow and try uh, different food textures, you want to try purees or maybe things like yogurts and that kind of consistency to get started.
What about food allergy concerns?
Mhm. So get this question a lot. Maybe, mom or dad has a food allergy. They're worried about passing it on to their child. Is this safe to give to their child? Um, Food allergies really do not pass down from, let's say a mother has a peanut allergy. It doesn't really pass to the baby in the sense of, oh, they are going to have a peanut allergy the moment they touch peanut butter or something. They may be at higher risk for developing a food allergy just based on genetics, but they're not necessarily going to get an allergy the first time they expose themselves to that food. To develop an allergy, you have to be exposed to something at least once to be allergic to something.
Hmm.
And we used to say, hey, to prevent allergies, we want to hold off on those foods. But actually, new research is showing early exposure to foods helps to reduce allergy risk. So, common allergens being peanuts, eggs, soy, wheat, milk, seafood. We want to expose those kids early. So when they're first starting to eat, maybe giving them, a little peanut butter on your finger and allowing them to eat a little peanut butter. Maybe really scrambling some eggs and give them a little bite of eggs. Maybe some wheat products like a little piece of bread. Exposing those foods to them early has actually been shown to reduce the risk of allergy.
Jeez, it's amazing. Are we on the bottom of the hour, Brad?
Yep.
Okay, it's time for our second break. It is the bottom of the hour, time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy.
WHBC AM 10, reliable as ever on News Talk 1480 WHBC.
WHBC News, a cross-county funeral procession planned for the Wayne County firefighter-paramedic killed a week ago in the West Salem area. Town and Country Fire Division announced yesterday service Paul Mikulik Monday afternoon. The Savior in Worcester. Session to follow on routes 302 and 301 to the West Salem Cemetery. Town and Country Fire Chief Adam Horry talked about the 5-year veteran firefighter-paramedic yesterday.
Paul had a love for the job. He had a love for helping people. He was a phenomenal paramedic, amazing teacher. He made everyone around him better.
Mikulik killed while assisting a stranded driver, both men. The Mahoney County dog breeder who took some Stark County residents and failed to deliver paid them back. A judge ordering 41-year-old April Waitman of Lloyd to pay back $100. Guilty back in February. She must. Third time, Perry Township's on the May 6th primary ballot seeking new road money. 14 at $2.9 mil levy in 5 years. Raise says go to pavement on the roadways. The next news coming up at the top of the hour and when it breaks. Michael, HBC.
Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off and Out by Store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off and Out by Store in Louisville, next to the Medicine Center Pharmacy. Medicine Center Pharmacies are now offering a service to help support your medication needs. We want to make sure that you have the medications you need when you need them. We will contact you 5 to 7 days in advance of your next medication refill to start the process each month. We will review your medications with you. We will contact your physician to initiate the process for refills and schedule a convenient day for pickup or home delivery. We simplify medication pickup into fewer pickups each month at the Medicine Center Pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Are you frustrated with the cost of prescription drugs? By now you know that your insurance price isn't always the best price on your medication. The new Health Matters Drug Savings Plan is simple. Easy way to save money at your local Medicine Center Pharmacy. No need to visit a website or disclose your private information, fumble with your smartphone, or print out coupons. Just talk to one of our friendly staff members and ask for the best price. Medicine Center Pharmacy with locations in Canton, Louisville, Minerva, and New Philadelphia, and online at medshoprx.com. Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off and Out by Store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off and Out by Store in Louisville, next to the Medicine Center Pharmacy. Have you ever gone to the pharmacy and decided not to fill a prescription because of the price? This is pharmacist Paul White. If you have skipped filling a prescription or a dose because of the price, we have great news for you. We are introducing a new membership program with wholesale pricing on every generic medication. Memberships are $5 a month. For many of our customers, our wholesale pricing is even less than their copay. Visit our website, medshoprx.com, and use our price checker to find out the price of your medication. Great deals at Medicine Center Pharmacy.
Your severe weather station, News Talk 1480 WHBC.
Here's a look at your AccuWeather forecast. A cloudy day in store with showers and thunderstorms arriving here shortly this morning. Will continue into tonight with a high of 69 and a low of 52. Still some showers tomorrow morning gives way to some sunshine, 56 degrees. Sunny skies Sunday, 63. And then on Monday, cloudier, 74. You can always get the latest weather news and forecast by downloading our free AccuWeather app. I'm meteorologist Jeff Nordine for News Talk 1480 WHBC.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. This morning, we're talking to Dr. Liebau with Aultman Medical Group Family Medicine of Stark County.
All right, doctor. Another question for you. Should I circumcise my child? Will it cause harm?
Yeah, this can be a really challenging decision for patients, or for parents, I should say. And it's a good question. And unfortunately, to make it clear as mud, there's no right answer to this. The American Academy of Pediatrics doesn't take a particular stance on whether children should or should not be circumcised. They really leave this up to the parental decision. Some reasons that people may choose circumcision may be, cultural. In all honesty, it may be something that the dad has received, and so for similarity's sake, it's something that they want their son to have as well. Some people, we mentioned cultural, religious. There may be other personal reasons for it. There have been some studies on maybe some potential health benefits that come with circumcision. Maybe not enough to sway that we say everybody should be circumcised. Again, the American Academy of Pediatrics really leaves it up to the parent. But there have been some research to show that circumcision may decrease the risk of urinary tract infections in men. And when that child becomes sexually active as they age, could reduce the risk of a sexually transmitted disease. Thinking about regional variations, the United States, unlike the rest of the world, does have a high rate of circumcision. Upwards of 80% of men in this country are circumcised, and that does vary a little bit by race. Whereas globally, actually, it's less common. And so that may be a factor too. Maybe somebody has immigrated from another country. Maybe had a different experience. So, or, living in this country, they may want their child to have an experience that's similar to other men in this country. When it comes to harms, circumcision is very safe. Probably the biggest risk is maybe there's a cosmetic outcome that the parent was not desiring, and a revision can be performed by a urologist to help get a certain cosmetic look. Some parents worry about, sexual function or sexual satisfaction. We're not seeing any evidence to show that circumcision impacts that in any way compared to people who are uncircumcised.
So what is safe sleep to avoid SIDS?
Yeah. So Safe Sleep is a program, a public health initiative to help children sleep safely to avoid SIDS, which is sudden infant death syndrome. And that's a condition or a situation where a child just dies suddenly, an infant dies suddenly, typically in their sleep for no explained reason. There's no evidence of trauma, illness, or other reason. And we found that, hey, maybe certain sleeping patterns increases the risk of this sudden infant death syndrome, and perhaps increases the risk of suffocation during sleep. Now, there's been lots of different approaches to sleep over the years, and currently the way that we approach sleep is through the ABC. So A standing for putting the patient alone in a sleep situation. They should not be co-sleeping with the parent either on their chest or in a crib. And then placing B stands for on their back. So all infants should be laid on their back when they go to sleep. And then C is in a crib or bassinet. Again, that kind of ties in with sleeping alone. They should be alone in a crib or bassinet. One When we think about alone, that also means no toys, no blankets, no bumpers. They should be in a crib with appropriately spaced slats so they don't get stuck or don't lean up on that and cover their airway. And by following the ABCs of safe sleep, we've seen reduction in that sudden infant death syndrome. I understand it can be really challenging when, babies just don't want to sleep and it seems like they just need to rest on mom and dad. As much as you can, following those ABCs of safe sleep is going to be the safest for the child. And will also help to establish a good sleep pattern so that you can, as a parent, get good sleep as well.
I can remember when my children were very, very young, getting up multiple times in the middle of the night while going in there to make sure they're still breathing. Okay.
Yeah. Yeah.
So
I'll add a couple of things because sometimes I've had parents say, oh, my mother, the child's grandma said, hey, put them on this, foam wedge, or hey, they should actually be laid on their stomach. And parents, maybe our parents grew up with that or grandparents grew up with that, and that was the guidelines given to them back in the day, and it's very well meaning, but I would just say, those guidelines have changed, and these are the new things that we're trying and the new things that we recommend. So if a grandparent or a parent recommends that, just kindly say, hey, my doctor said this is the new thing that we're doing, and we should sleep in this. And then the other thing I would say is, when children start to roll, if they're really young, let's say they roll less than a month age, roll them back because they're not strong enough to roll from front to back. But as they approach 4 months of age, where they are able to roll on their front to back by themselves, it's okay. I would lay them on their back to start, but then if they roll in the middle of the night, you can leave them alone. They're strong enough to turn their head and roll their body.
Interesting. Okay. How about the infant that won't sleep through the night? What do I do next?
Yeah. So very ideal if you can lay the baby to bed and then they sleep through the night. Obviously, in the early stages, especially that first 2 weeks to month, baby's going to be waking up every 2 to 3 months to eat, and we expect that. We want that. We want them to be getting good nutrition to get back to their birth weight and to keep growing. As they age, we expect the frequency of waking up in the night to gradually space out until they are sleeping throughout the night. And obviously, a baby that's waking up throughout the night is a challenge for any parent, causes sleep deprivation and stress and can be really difficult. Some things that we may recommend, for the baby that's crying, hopping around, patting them on the back, white noise can be helpful, shushing or singing a lullaby, things that maybe they have already tried before. If you need to, while you're awake, co-sleep with them to get them to fall asleep and then put them down. Now the parent is not asleep, but you're helping them fall asleep on you and then put them down. That could be an option. Alternatively, get them to a twilight zone where they're almost asleep, put them down in a slightly awake but slightly asleep state and help them fall asleep. That can be helpful. One of the biggest keys is routine. Babies thrive on routine. They fall asleep to routine. So try to follow the same routine night after night, going to bed at the same time, napping at the same time, doing the same things leading up to that. That can help them fall asleep. One other thing is sometimes a bath. Typically, we recommend a bath with soap 2 to 3 times per week. But sometimes just getting them in some warm water can be soothing, and that can help them fall asleep as well.
Interesting. Okay. So what are some safety things to think about with infants and small children?
Good question. So thinking about the maybe that newborn stage. So some things that we'll talk about with parents is we talked about the fevers earlier today. We'll also talk about car seats. So it's important to have an appropriately fit car seat. And until they're 2 years old, that car seat should be rear facing. You should follow the car seat manufacturer's guidelines when it comes to like the weight and size limitations of that car seat, but really they should be rear facing up to 2 years of age. Um, we'll talk about water safety. So your water heater should be set to no more than 120 degrees Fahrenheit to prevent
Hmm.
unnecessary burns. It's not uncommon where we think the water is cool enough, but it's actually too hot and babies can be burned. When that baby's walking, thinking about even small pools of water, as little of an inch is enough for a baby to drown. So, no buckets with
Jeez.
water. The tub is completely drained. If you have a pool, make sure you have a fence completely 360 degrees around that pool so that they can't get in. Outlets, putting plugs over those outlets, even if they're tamper proof, I think having a cover is good. Um, Putting locks in cabinets, storing chemicals away from access from baby, medication away from access from the baby. Thinking about furniture that can tip over, bookshelves, uh, uh, stands, other things like that, and maybe putting um, a tip-proof device, drilling something into the wall to prevent that furniture from falling over in case the baby climbs on it.
Hmm.
Baby gates, things like that. All of that is thinking about in the infant stage, and certainly as children are entering school age, teenage years, there's all kinds of safety
Hmm.
things that we talk about at that age as well.
Hmm.
Wow.
Okay, time for our final break. You're listening to Health Matters with the Medicine Center Pharmacy.
Are you frustrated with the cost of prescription drugs? By now, you know that your insurance price isn't always the best price on your medication. The new Health Matters drug plan is a simple, easy way to save money at your local medicine center pharmacy. No need to visit GoodRx or Single Care, disclose your private information, or print out coupons. Just talk to one of our friendly staff members and ask for the best price. It is that easy. Medicine Center Pharmacy with locations in Canton, Louisville, Minerva, and New Philadelphia, and online at medshoprx.com. Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off on Out by Store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off on Out by Store in Louisville, next to the Medicine Center Pharmacy. Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off on Out by Store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off on Out by Store in Louisville, next to the Medicine Center Pharmacy. Medicine Center pharmacies are now offering a service to help support your medication needs. We want to make sure that you have the medications you need when you need them. We will contact you 5 to 7 days in advance of your next medication refill to start the process each month. We will review your medications with you. We will contact your physician to initiate the process for refills and schedule a convenient day for pickup or home delivery. We simplify medication pickup into fewer pickups each month at the Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Have you ever gone to the pharmacy and decided not to fill a prescription because of the price? This is pharmacist Paul White. If you have skipped filling a prescription or a dose because of the price, we have great news for you. We are introducing a new membership program with wholesale pricing on every generic medication. Memberships are $5 a month. For many of our customers, our wholesale pricing is even less than their copay. Visit our website, medshoprx.com, and use our price checker to find out the price of your medication. Great deals at Medicine Center Pharmacy.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. I am your pharmacist, Paul White. Thank you for joining us. Let's get back to the last segment of the show.
Okay, let's talk about some potty things. When the baby is really grunting while trying to have a bowel movement, is that a sign of constipation? And what does a parent do to responsibly treat that?
Yeah. That can be a really distressing thing to see, baby really pushing, face is turning red, looks like they're really struggling. And not uncommonly, parents will think, hey, my baby is constipated. When it comes to normal stool patterns for a baby, it can be highly variable. We may see commonly babies poop multiple times a day, but it's also not uncommon for a baby to poop maybe once or twice a week. And we would say that's all normal. Sometimes that varies based on
Jeez.
what's their nutrition, from breastfeeding to formula. Breastfeeding tends to have a little bit more frequent stools. And then if they start to transition to table foods, the consistency and the frequency of their stooling may change as well. I often tell parents, for newborns especially, they do five things. They eat, sleep, pee, poop, and cry. And pooping is about the hardest thing that they're doing in life. And so it requires a lot of effort for them to get that poop out. Um, and just like breastfeeding, though it's an instinct, but they have to learn how to do it. They also have to learn how to poop. So it requires a complex coordination of relaxing and pushing, and the babies are learning to coordinate that. And so sometimes they're not efficient with that process, but with time, they get better and it requires less effort. Um, some things that may be concerning for constipation would be if their stool is really hard. Maybe if it's firm, lumpy, pebbly, that may be concerning for constipation. If there's blood in the stool, that can be a concern, or if there's tearing around the anal area, that could be concerning for constipation. Maybe if the baby is not eating well and we're having some of these things, that can be concerning for constipation. If maybe an older child who can talk is telling you that my stomach hurts, the most common cause of stomach pain in children is constipation. And thinking a little bit in the older years, it's not uncommon for children to develop constipation when uh, they start potty training, because that can be stressful. They go to school, or maybe there's changes in the home, like if there's maybe they move houses, or maybe there's a divorce in the family. Those can lead to constipation.
Jeez.
Okay, so another parental challenge. When is it time to begin the journey of potty training?
Yes, well, unfortunately, babies don't come out ready to use the toilet right away. That would make everybody's lives easier. And I'm sure lots of parents are, waiting ever so patiently to start potty training. It can vary on the child. Typically, we will say the average range is around 3 years old, give or take 6 months. Some children may even show signs of it earlier. Some developmental milestones that we look for when children are ready to potty train. One, are they starting to hold their urine or their stool? Are they going multiple hours with having a dry diaper? That really is an important thing, some continence to be able to use a toilet. Are they telling the parents, "Hey, I wet my diaper, or I made a dirty diaper"? Are they recognizing that happened? Are they uncomfortable by that? Wanting to get that out of their diaper, that's another milestone. Are they able to take their pants down or pull their diaper down? That's an important milestone. When we're starting to see that, then we can say, hey, we can start to initiate some toilet training, and that may involve, having a potty, maybe just showing them the potty, like, hey, this is a potty that you use, just like mommy or daddy. Maybe they even watch mommy or daddy use a toilet. Or an older sibling use the toilet. Having them sit on it, maybe not even with the plan of using the potty, but just have them get used to that experience. And then, teaching them like, hey, this is where we're going to go to the bathroom, or if they go number one or number two in their diaper, put them on the toilet and teach them like, hey, we're going to get the rest out, or we're going to practice. This is where we do this. Children may resist, and that's okay. We don't want it to be a miserable experience, because that delays potty training. And so if they're not ready for it, it may be a time to, take a step back and revisit a few months later.
What about the inevitable trying to soothe a crying baby? What are some tips there?
This can be really challenging. I think a lot of parents find different ways to soothe their child. Maybe they recognize their baby's cries or recognize certain behaviors as, oh, baby is hungry, or maybe baby has a dirty diaper. Again, I think common things similar to sleeping that also work with crying, bouncing around, singing, talking to the baby, swaddling, especially at the young age, that 0 to 4 month age, swaddling can be really comforting. Skin to skin contact at that early age can be really comforting. Um, Pacifiers, if parents are wanting to use pacifiers, that can be the sucking. Just that pacifier sucking motion can be helpful. Certainly if it's their eating time, is like, hey, is it eating time? Going through your checklist, is it time to eat? Is it time to change the diaper? Um, are they hot? Are they cold? Are they sick? Is there any sign of pain? Sometimes, if you can't figure things out, undress the baby because maybe there's a rash, maybe there's an injury. We talk about hair tourniquets. So sometimes a piece of hair can get wrapped around a finger or a toe or a male member as well. So, it's good to undress the baby to make sure that there's none of that. And then sometimes, unfortunately, babies can have colic, and we talk about the rules of three. So if they cry uncontrollably for 3 hours, at least 3 days per week, in the ages of 3 weeks to 3 months, your baby may have colic, and sometimes it's just difficult to console those children. The good thing about colic is, though you may see your doctor and they can examine the baby, sometimes everything looks okay and there's no underlying health concern with that.
Hmm. We're getting a little tight for time here. A couple questions quick, okay?
Yeah.
Or three. When do teeth start coming in and should they be brushed? How often should you bathe the baby? I guess those two. Go ahead.
Yeah, we talked bathing real quick. We talked about briefly, a couple times a week is fine. Use like a gentle baby soap. One thing I'll say is in those first 2 weeks when you're managing the umbilical cord, you don't want to submerge that because that'll delay removal of the umbilical cord. When it comes to teeth, usually around 6, 7 months of age, we'll start to see teeth coming in. Kind of our rule is at age 7 months, we'll see that first eruption of teeth. And then we add on for every 4 months, we should see 4 additional teeth. So at 11 months, we should see 4 teeth, 15 months, 8 teeth, and so on and so forth until their mouth is full of teeth. And we do recommend brushing teeth with the first eruption of teeth and actually using fluoridated toothpaste, baby toothpaste, that is safe for them to swallow. In the infant and toddler range, just a little, like the size of a grain of rice is sufficient.
How about measles? We're getting some measles cases in northeastern Ohio.
Yeah.
What should I do to protect my child?
Yeah, if parents weren't aware, we have measles in Ashtabula County and Holmes County. So depending on where they live, that can be really close to home. If you're in the Canton area, that's only about an hour away. The number one thing that you can do to protect your child is to vaccinate. As of the early 2000s, we had said, hey, measles is eradicated in the US. Now, there may be pockets of outbreaks here and there, and we still say they're eradicated, but based on the number of cases in this country, this may be the year that the US loses the eradication status. We may say that measles is no longer eradicated in this country. The best thing that you can do is vaccinate. The vaccination is exceptionally safe. There's parents will produce lots of concerns about autism, mercury, different other products in there. We've heard those concerns. We've removed mercury. We've removed lots of different, preservatives that families are concerned about. And there is no data to support that MMR or any other vaccine causes autism or any other developmental concern. So vaccinate your child.
Wow. How are we doing, Red, for time?
Well, we're tight. So, doctor, any final words and how patients or parents can get in contact with you?
Yeah, I would say so. I am taking new patients. I'm at the Aultman Medical Group or with the Aultman Health System. Our office is called Family Medicine of Stark County. Our phone number is 330-499-5600. I'm taking new patients, including the newborn age. So if you're pregnant and looking for a pediatrician, or if you have a child and looking for a new doctor, I'm happy to see them. We also have other providers in our office that are taking new patients and seeing children as well. Um, One thing I'll say, so I gave a lot of advice on here, and this is very general advice. This is for the general population, but maybe your child has specific circumstances that maybe not everything applies. So I think, it's always great, like we said before, have a pediatrician or a family doctor that you trust, that you can go to, who knows your child's and their health situation, their living situation, and can give you individual recommendations that is right for your child. Now, that may be based on the traditional guidelines and things like that, but maybe there are some tweaks that is right for your child. So, one, always talk to your doctor if you have questions. Two, if you do decide to, browse the internet for some information, it's good to find good resources. I would say always be cautious, especially cautious on social media. There's a lot of inaccurate or false resources. Other internet resources, you have to do your due diligence. One that I really recommend to parents is a website called healthychildren.org. This comes from the American Academy of Pediatrics. It's a website that is designed for parents in a way that they can understand and covers all these topics and more that we talked about today.
Okay. Hey, thank you, Dr. Liebau. We really appreciate you coming on and talking about all these things. We get questions like this in the pharmacy,
Thanks for having me.
Yes, sir. Thanks to Aultman Health System for our listeners joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week. We'll see you again next Friday right here on News Talk 1480 WHBC. Thanks, Doctor, very much.
Thank you very much. Great program.
Bye.